Hi everyone, so today we're going to have a quick session on some extended writing practice in psychology, and in particular we're going to be having a look at the key question in the cognitive approach, because it's an area I think that students do struggle with answering questions on. So we're going to have a look at type of questions that you might have on a key question or a key issue and how you'd go about answering those questions. So the question that I have chosen for the cognitive key question is, how can psychologists' understanding of memory help patients with dementia? For 8 marks. So, firstly, you need to have an understanding of dementia and the cognitive theories which link in with dementia. Okay, this is a question which requires AO1 and AO2. Okay, so description and application. Okay, because you're describing dementia for AO1 and then you are applying the theories of memory to explain how we can help with dementia. Okay, so that's obviously AO2. So, firstly, how would you go about answering this question? So you would start by looking at the basics, looking at the question. It's obviously asking about dementia. So you need to show some knowledge of dementia. So this is obviously knowledge, description, AO1 marks. Okay, so describe a little bit of information about dementia, the fact that it's a chronic disorder affecting mental processes, causing memory impairment, affected by age. The older obviously you are, the worse it is. So some information and a bit of detail about what exactly dementia is. Then after that, you'd go on to talk about the link to society, because it's a key question. You have to remember every key question in psychology is always related to society in some way. Okay, so dementia is obviously a chronic disorder, and you need to be explaining why it's a problem in society for, again, description. It's a problem in society because over the years there has been an increase in rates of dementia, and by I think 2025 we expected to have 1 million people, okay, with dementia. And it's a problem because people struggle with everyday tasks, and family are struggling to look after their loved ones. Okay, and it is a problem. So talk a little bit about why it's a problem in society, who it affects, what the consequences of dementia are. Okay, so all of those are descriptive. Then you'd start mentioning some of the cognitive theories that you've looked at within the cognitive approach. Okay, and what the aim is to use those theories to explain or link to dementia or aspects of dementia. Okay, so this is obviously AO2 in application now. So some of the theories that you could mention or use are, for example, episodic memory. So remember, episodic memory is all about autobiographical memory. And in dementia, I think that patients do tend to remember autobiographical memory a lot more. So remember, this is all relating to our experiences, our unique experiences, special events. And I think dementia patients do tend to remember their youth, their younger days when they were children more. So it's a good idea to maybe talk to dementia patients about their childhood, just to trigger some memories, because that was probably the best part of their life. You could also talk about multi-store model. So the whole idea of rehearsal, rehearsal over information obviously gives it a longer chance of, the memory lasting. So with dementia patients, I think, a common strategy technique is obviously rehearsing over information when you're talking to them, going over the key things again, little reminders. So rehearsal. So again, you use multi-store model aspects of that to explain how we can help dementia patients. You could also talk about working memory model as well. So remember, working memory model is obviously the 3 components, and the idea of multitasking is very difficult for a dementia patient. So working memory model can be applied to this because we know that to carry out two tasks simultaneously using the same sense is impossible. Okay, so again, dementia patients will struggle with this a lot more. Things like cutting out the background noise when you're talking to dementia patients so that they can hear you better, so that they can concentrate a bit better. So techniques like this would, help dementia patients. So you could use working memory. You could also look at reconstructive memory if you wanted to. You could look at the idea of schemas, how obviously, and then link it with dementia patients tend to remember familiar things more, which are in line with their schemas. So really to talk about familiarity more to them, things that they've experienced, things that might be part of their schema. And again, this will help them as well. Obviously, you don't have to talk about all of those theories. So talk about one or two of those theories in detail, the ones that obviously you're most familiar with and comfortable with writing about. Then really finish off by talking about cognitive stimulation treatment and therapy, which again really looks at cognitively stimulating the brains of dementia patients, rehearsal of information, so breaking things down into smaller chunks, taking them to familiar settings will really jog their memories. Okay, so really, just to summarize this question, this plan here, you'd obviously be starting off with some description of dementia and how it's a problem in society. So don't forget to link it with society because that's the main aim of a key question. And then really give some examples of cognitive theory and apply it to dementia. So there you go. That's a plan really for this question. So have a go at planning and have a go at answering this question.